Hello friends, we are here today with one of my favorite clients in our practice, Gigi. First met Gigi 2 years ago approximately. We did her under eyes. It's lasted that long. The effects are still there. Her main issue was she felt the bags underneath her eyes were excessive. Our goal today, again, is to do her under eyes. We've already numbed her up. We're going to do a little bit of cleaning. I'm going to mark the area and go from there. My technique is using a cannula. You see other people, they will probably inject the under eye 12 times on each side. To me, one that's uncomfortable, it causes bruising, and it's risky. There are a lot of vessels and nerves close to the orbit here, especially in the central aspect of the face, that can cause long-term issues. The first thing I care about talking to patients about is safety. I try to let them know what risks are and try to reduce risks as much as possible. Anytime you do a procedure, there's a risk, whether it's something injectable and cosmetic or surgical like a facelift. I take the same approach to everyone, reducing the risk while optimizing our ability to get the best outcome possible. So let's start by marking. I consider the under eyes and the eye area and the central cheek area as one complex. If you look at people's faces, you want to see a smooth, round transition from the lower eyelid down to the face. You want fullness coming out this way. To me, that's youthfulness. Youthfulness is heart-shaped face with a lot of volume here, tapering down the jawline. Cheeks are important and they go hand in hand with the under eyes. A lot of people come see me because of bags. They come see me because of under eye dark lines. I would say a good majority of people are candidates for under eye rejuvenation just with filler alone. Surgery is an option as well. Some people are not willing for the downtime nor the risk. This is a terrific alternative, and in the younger age population, this is a wonderful rejuvenating procedure. Let's get started. We just make one little entry point here, and then I get access to the undersurface of the eyes, and I leave the filler there to give her a little bit of projection outward because she's a little flatter on this side than this side. Here the main issue is this hollowing here, which we're gonna fill. Here is to project the cheek out, which will also help with the lower eyelid aesthetic. 1, 2, and 3. That's the only sharp point of entry that we're gonna need. Okay, let me get the Q-tip. Go ahead and remove it up. Hold this for me, please. I'm gonna feel a pop. You okay, my dear? Is this super painful? Okay. We are traveling underneath the soft tissue skin area. Once you are through the skin layer, you have no nerve endings. It becomes more pressure and discomfort as opposed to frank pain. It may sting a little bit, so I'm just trying to get to the point where I need to be with a little bit of pressure. Okay, there we go. I'm in the right spot. Let me get my finger. My thumb is what tells me where the edge of my cannula is. You okay? Mm-hmm. Okay, I'm happy with it. Right there. Beautiful. And then injecting one. Let's grab a mirror and have her take a look. I think I need a tiny little bit left. You can point, you tell me where you feel like you still need some in that area. We're gonna come back.
There.
Okay.
But that's not too close.
Let me see. I'm thinking
Dangerous.
this area right here
Yeah.
is where you need it. We can put it there. That's not a problem whatsoever. The entry point is still where we will get in. The undersurface, another pop. You felt that, I'm sure.
No, I heard it.
This is probably the most powerful thing that I can do just with fillers alone in terms of helping people. Okay, there we go. In the right spot, I believe. You could see the end of my cannula right there. Do you see that? Let's inject it. Tiny bit there. Okay, good. That's all, folks. Let's go to the other side. And I'm gonna come back and top it off as needed.
Okay.
But that looks super natural.
Yeah.
The transition now from your lower eyelid down to your cheek is a lot smoother.
Yeah.
And the bags are gone.
Yeah.
Other side. 1, 2, 3. A little bit of pressure. One side can always be a little bit more uncomfortable than the other. We're not exactly the same on both sides. Now you can turn your head towards me. Excellent. Hold it right there. Feel where I am with the tip of my cannula. Right where I need to be. How you doing?
Good.
Pretty quick. That's a lot better because now you have no projection there. I'm
Right.
still going to lay a little bit more right there,
Yeah.
and then we're done.
Okay.